My name is Nicole McSweeney, and I'm the Chief Marketing Philanthropy Officer here at Maine General. And today we'd like to bring you some helpful information regarding the coronavirus.
I'm Steve Diaz, the Chief Medical Officer for Maine General Health, and here this morning to give you information about the coronavirus or COVID-19.
So, a lot's been happening with coronavirus or COVID-19.
It has been very interesting times here in the United States with coronavirus or COVID-19. It started a few months ago with an outbreak in Wuhan, China. Wuhan had a few cases and they didn't talk about it very much, or they were not very transparent. Since then, it has spread globally. We are seeing more cases now in the U.S. diagnosed, but according to Dr. Anthony Fauci from the National Institute of Allergy and Infectious Disease, it has probably been here for a while. One of the issues is that it's transmitted silently almost, or insidious, in young children and young adults who are healthy. We have not tested as much as other countries have tested, such as Korea, to get a hold of it, mainly due to supply issues. We are testing people appropriately, but at this point we don't know what's called the true denominator, how much it really is spread, and in many ways it is spread through children and adults who think they just have the cold, because that's what it feels like, but really this virus seems to be more morbid or with higher case fatality rates in those who are older or with significant comorbid medical conditions such as lung disease or heart disease.
So, what does this really mean for the common person? What should I do? What should my neighbors do? What should my family do?
That's a great question. The thing to do is to really use social distancing, and that is every year we have the flu virus, and we tell you every year, if you're sick, stay home. Otherwise, please wash your hands. Don't touch your eyes, your nose, your mouth. Don't shake hands. And whenever possible, sneeze into a tissue. If that's not available, your elbow. And then again, wash your hands. The advice for this is actually the same. The infection is spread by close proximity. Someone who's actually sick radiating the virus through their cough or sneezes. And staying away 5 or 6 feet seems to help a lot. And again, if you're ill, the biggest part is staying home. We do have a sense of being a little sick and saying, oh, I think I can get away with it. I'm not really that contagious. You can't tell by the way you feel. If you have a fever, if you're coughing, if you have a cold or flu-like symptoms, really you should be staying home and taking care of yourself.
So, it sounds like the big message is stay home.
Yes, stay home. Especially now that it's become what's known as a pandemic. It has significant growth in more than 2 to 3 countries. It's a worldwide phenomenon. And unlike the flu, we don't have a vaccine in order to give people some way to fight it. We don't have a proven medication to fight it. Again, for the flu virus, we have a few antivirals we can use. There are some being tested, but right now, it's really hydration, avoid getting the infection, and again, the tenets are the same as for avoiding the flu.
So, if I become more sick, so I had a little cough, and now I feel like I have a fever. I've tested, I have a fever. I'm starting to have some difficulty breathing. What should I do? So I'm hearing maybe I should go to my primary care office. What steps should I take if I'm not feeling well?
Depending on how unwell you feel, the first call should be to your primary care provider. Call your doctor, see what they think. If they know you well, they can give you good advice. If for some reason you feel that is not enough, that you need more care, and or your doctor feels the same way, the appropriate place is the emergency department. One thing that'd be good to do, though, is to call the emergency department first so they can be prepared for you. As with any infection, we would like people not to spread the infection as they come in, and it helps us to prepare and sort you to the right destination when you get here if we know you're coming.
So if I come in and I get tested and we're not going to know the results right away, and I'm not going to be hospitalized, what do I do?
In that case, you go home and rest. Hydrate, chicken soup, some TLC, stream your favorite videos. But the idea is to go home and rest. Don't have visitors. Your immediate family will be with you, of course. And for what it's worth, they've already been exposed as well. But it's still good to practice good hygiene. Sneeze or cough into a tissue, wash your hands, don't touch anybody. And things stay the same. That's the course you're going to follow no matter what. If you feel worse or things get worse, call your doctor, or again, if you think you need the emergency department, call first but then go.
Now, washing your hands. I hear there's a couple of different ways in which you could wash your hands, or the length or duration of time you should wash your hands.
Yes, it's not a quick wash. I have many children and they do the 2-second wash, and that's not what we're talking about. You want to wash for 20 seconds. So sing happy birthday. Dancing Queen's a good song as well. You sing it to yourself while you're washing your hands. If you have a good voice, you can sing out loud. One of the common questions as well is the hand sanitizer. I did see those 2 brothers in Tennessee who can't sell what they hoarded, which is interesting. But in any event, hand sanitizer does work for this virus. It's a good question because hand sanitizer does not work for every infection, but for this one, it does work.
Now, if I want more information on this, I've heard about the CDC, I've heard about 211. Talk about some of those resources available.
Yes. So the state of Maine has a phone line called 211. They give general information about this virus. It's a great resource. If you're just looking for more information and phone calls work for you, that is the way to go. If you are online and want to see more information, both the Maine CDC and the National CDC have fantastic websites. You can just Google or Bing or whatever search engine you use to those places, and they will have more information than you ever thought was possible. The information there is both up to date. They update it Monday through Friday on a daily basis. It has also teaching materials. They have things you can read. If you have children, it has children appropriate material, and also has posters or other types of things you can print off if you want to put some signage up around to help you manage through this time.
So a lot of the schools are closing.
Mm-hmm.
And for the parents out there that are concerned or confused and really trying to delineate, do I send my kids to daycare? Do I try to find alternative daycare? Do I try to stay home from work? What are some things I should try to take into evaluation to think about what's best for my family?
And it's a really hard question. So if we start with the tenets of why they're doing that, it turns out that mass gatherings, and I know that number gets somewhat arbitrarily assigned at times. In Italy, they use the number 20 people, and right now in the U.S. it's 50. That those gatherings allow passage of the virus more easily than smaller gatherings, and that's all true. It has to do with, of course, distance or density of a room. The other reason why they focus on children is that children and young adults can have the virus and pass it seemingly innocently, of course, and also without significant burden of disease on them. They don't show many symptoms. So that's a problem because then you can pass it around and it gets passed very easily. The issue are those who are older with other issues, again, such as heart or lung disease, that passing to them will not be so innocent. So to answer the daycare question that comes from the schools, the idea is it'll have to be very individual. If you don't have access routinely to people who are older or more infirm or with weakened immune systems, then perhaps having children in a place with other children, small groups, is okay. If you feel that you do have significant risk with either having family members or visiting elderly parents or other relatives who are older or friends on a routine basis, because that's part of what you have to do, having children in more defined areas such as a babysitter who can oversee your children only might be a better option. So it is very dependent. And again, the dependency is not so much for you and your immediate family, most likely, but again, those who you network with on a as needed basis or because you have to, and that is you're supporting someone who's elderly or under some treatments, which again suppresses the immune system.
What are some of the safety precautions the hospital has put into effect for patients and visitors?
Yes, if you come to us and you need to be seen for your cold-like symptoms or flu-like symptoms, we will have you wear a mask if you are having those symptoms, and then we will mask and gown and or put gloves on as appropriate as well in order to help you and examine you. If it turns out that your infection appears to be clinically highly infective or we have concerns that you might have COVID-19, we might even increase the level of personal protective equipment that we use in order to make you, your family, and others safe.
Are we limiting the number of visitors or people who should be coming to the hospital?
Yes. One of the things, again, is just people traffic, right? Number of people moving around an area. We are limiting visitors to one adult per patient, and the adult visitor needs to be well. We don't want people visiting who are ill. Children, again, because they can pass this around with us not knowing it, we are including them. There are exceptions to the rule. If people are terminal or with end-of-life care, or if there's other extenuating circumstances, we can take that into account. But by and large, limiting influx of visitors in and out of facilities will help us nip this in the bud. So the most important things would be, number one, social distancing. Try to stay a little bit away from people. You have to have a conversation. 5 to 6 feet is if you're really in a larger group, 5 to 10 people, but really keeping your hands to yourself. If you sneeze or cough, use a tissue. Please wash your hands. Don't touch your eyes, your nose, or your mouth. That's actually a very hard habit to break, I understand. And then the other part would be that if you are sick, stay home. The difference between that and social distancing is if you're staying home, we really want you to stay home. That doesn't mean going shopping, going to the movie theater, going out to lunch because now you're home for the day. Stay home till you're all better. And if you have any questions, just check in with your doctor.
Is there anything we haven't discussed today that you'd like to talk about?
I think it's important as well for people to understand that a lot of this is part of natural course of how humans exist on Earth. It's good to plan, it's good to prepare, it's good to practice good hygiene and social distancing, and good to be calm. Especially if you're the one who sort of people look to in your family or group of friends to help them manage through times. It's good to know that the way you protect yourself is also very important. If you have children, they will look to you and they'll feed off of your reactions or anxieties. And again, the best thing you can do is be calm. For the healthcare systems that are around us in Maine, we all prepare all the time for emergencies. We all have plans and preparations for infectious diseases that become emergencies as well. The best thing we can all do is work together and stay calm.